How are you?
Hello. How are you?
I'm doing good. How are you?
I am well, thank you. I just love seeing your face. You make me so happy.
I love talking with you
I
too.
know. You
Uh,
just make me so happy. I just, I love everything that you're doing.
oh,
Absolutely
thank you.
everything.
Thank
It's
you.
just how's the baby?
The baby is good.
Yeah.
We had a little feeding session before, but hey, let's talk about you because I've been watching you. You've been doing a lot of great things.
Oh
And
man, thank you.
I'm like, wow.
I'm so blessed. You know how it is. The awesomeness of God is just like, I mean, sometimes it's overwhelming,
Yeah.
and I don't know. I don't know what he's up to, but he's up to it, right? And uh I'm trying to be obedient, right? I'm not good at it. So
Hey, but
I'm not the best at being
that's what his
obedient,
grace is for.
right? Right? So I'm like, you know, I just I know that m- my job is to be a conduit. That's what I know to be true, right? Like I tell people, I'm not a doctor, I'm not a healthcare professional, I'm not a practitioner, but I know that my job is to connect people to people that is what they do,
Uh-huh.
right? And to give them very clear, accurate, and science based information,
Hmm.
right? And things that are attainable. So that's what I'm trying to do, and that's what, like, I promise you, I if I could have brought you here, I would have had you here, like, for shiftHER elevate pause. Like, it was just it was
It looked good.
it was beyond what I don't even know what happened. And because you understand what I'm talking about, you have a vision, you're given a vision, right?
Uh-huh.
And then you're in it, so you don't really see how it's unfolded. You don't see it unfolding, and then when it's there, you're like, like, wow, 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 right? You know what my goal was? My goal was to put educated, fact based, science based Black practitioners in front of people. That was my
Mm.
goal. And I did just that. And that people like you are practitioners, right? I'm telling you what I know. I'm not telling you what I read in a book,
Yeah.
right? I'm telling you what I know. I've seen it. I put it into practice.
Yeah.
So it was very successful. I can't wait to send the video to you because we did record it. It looks like a movie. It's unbelievable, right? And to see that people were so engaged. So I cannot wait because I do have something up my sleeve
I know.
for a couple of things up my sleeve for 2025. And I'm just gonna need you to put the baby on your back. That's what I'm gonna
Hey, baby's going on back activated.
activation, right? So because what you've done with this series, and I love that you're calling it the reversal series,
Yes.
right? Like, because I didn't notice that at first,
Yeah.
and I was like, okay, which speaks to our faith. Also, we're reversing things, we're turning things around,
Yes.
right? Curing is not a requisite, right? But
Yes.
reversing behaviors and what have you is.
Yes.
So when you say reversal series, we have reverse high blood pressure naturally, which we've already done,
Yes.
right? Right, guys, I'm sorry, we're jumping right in because that's what we do, right? So you do know that this is Dr. Christine Nwoha. Okay,
Hey.
let's get into that, right? She is a preeminent physician, a hospitalist, right? And she'll
Uh-huh.
explain to you what that is so you're clear on that.
Yes.
But she also is somebody that gets to the root of things, which I would say is functional and integrative medicine.
Yes.
Yes, and she's board certified, so let's not get that all confused
Please
either. Please
don't.
don't. Okay. All right. And she's got a busy life. So the fact that she's dedicating time to us tonight, but also to her patients, she's got children, she's got a husband, she has family, right? And so she's here. So I think that that's a good thing, and we need to be happy about that, right?
But I love it. I love it.
And that's why we're here for this series, right? So reversing high blood pressure naturally, we did this, and now you've
Yeah.
released how to reverse type 2 diabetes naturally, right? Which, yikes. I mean, as soon as you open up the first page, you write into it. Like, you use your family as,
Yeah.
like, example, because we all can relate to that.
Yeah.
We all know there's somebody, right? But to be your dad,
Yeah.
right? The people that save us, right? So to see that that's the first place you start. So kind of unpack like that.
Man. So, sometimes in what you do, it hits harder when it's you or your family. Like it puts it into perspective. You can study as many things as you can from a book, but when it hits home, you got to think about things differently. And my father's had diabetes for as long as I can remember. Um, and I would never consider him as sick. It was just like he had diabetes, okay. But when he got sick, that's when I was like, oh, whoa, 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 whoa. I could actually lose my dad.
And what do you mean by sick?
He was in the hospital with pneumonia, and um, he was in a different hospital. So I couldn't even have the tangible information in my hands to know how sick he was. He said his kidneys were affected, and my world started to spin, and I felt helpless. And I felt almost like, how you're like, how can we undo this? Like, how can we turn back the hands of time so my daddy wouldn't be in this position?
Right.
Because if the medicines aren't working, if he's taking his medicines, the diet's not working, he's getting sick. I don't want to lose my dad. And it was at that point as a physician, I felt helpless because I'm not, I giving my father medicine wasn't what I wanted to do. I wanted to help him. And that's when I started getting into most of my priests. Actually, my dad is where this all started, really, because that's when I started to backtrack everything. And I had that conversation with him like, Daddy, I don't want to lose you.
That's simple.
I don't want to lose you. So we got to do this differently. And I actually thank him because if he hadn't, I mean, I know eventually it would have happened, but if he hadn't been so willing and open to trying whatever I was throwing at him, I don't know how long it would have taken me to get here or how I would have gotten here. But because we were able to reverse diabetes in him, it it like put a light bulb off in my mind. Like this is so possible. It's it's so possible. Like when I say my dad went from having blood sugars in the 500s, he
Wait,
had
wait, wait,
in the
wait, wait. How
500s.
did
He had a little fridge next to his bed where he put his insulin because he didn't want to go all the way downstairs because insulin has to be
right,
refrigerated. He didn't want to go all the way downstairs, so he had his fridge there for his as needed PRN insulin. We went from sugars of 500, A1C, that's the way that you measure hemoglobin. A1C is how you measure how bad your diabetes is, of 13 to not needing insulin.
that's a huge leap.
Not needing insulin. And people don't, even his own doctor was like, what did you do? It's possible. We see it all the time.
Well,
And,
500
and
is just I'm like it's making my heart race even like hearing
doctors
that.
see it all the time. I see it all the time in the hospital. I have patients that they're hospitalized for 6 days or more. At home, their insulin is 60 in the morning, 60 at night, something ridiculously high. The I don't even give a lot of times when I hospitalize patients, I don't even give them their home dose because I'm like, no, 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 we're not gonna do that because when you get in the hospital, we control your
Right,
diet and such and such. A lot of times your NPO, which is fasting,
yeah,
and you're on like a strict diet. If I give you that 60 you were taking at home, I'm gonna plummet your blood sugars.
correct.
So I have it. Most times when we're there, they're not getting a fraction of a dose of the insulin they're getting at home. What does that tell me? That tells me that a lot of it's your lifestyle. A
So
lot of it's your
so
lifestyle.
net type 2 diabetes is overall a lifestyle disease.
A lot of it is.
So
Type 1 is more genetic. Type 2, a lot of it is just lifestyle. Now, I'm not even going to say, okay, it's lifestyle because you're doing something wrong. That's not it either. Because some of it is our society and the way we're trained and the information we're fed and the advice we're given. And it gets real complex. But a lot of it is our lifestyle when it comes down to it.
with type 2 diabetes.
Yeah.
So what okay. I know everybody thinks they know what diabetes is. And in the book, you jump right in with that as well. You give us a story, but you also then move right on to what is diabetes. So
Yeah.
why don't you tell everybody what is it?
So basically, when you eat, your body, you're eating your food that's fuel to do what you got to do through the day. But your body knows you can't constantly be eating, so it needs to store some of that fuel for when you're not eating. And maybe overnight, or maybe if you have to, because you're fasting most of the day, right? You're not eating constantly. So your body has to find a way to take the food that you're eating, like the glucose, and package it in little compartments that it's going to use to store for later. Now, when you have diabetes, there's a problem with that process. For whatever reason, you're not able to store or utilize or do any of those processes very well. And that leads to you having elevated blood sugar in your system. Now, here's the thing, when you eat and that blood sugar in your system goes up, sugar is toxic. It shouldn't be there, it shouldn't be in your bloodstream. Your body naturally packs that up and wraps it up real quick. But when you have certain components in your body, like the insulin, the key that's opening up your cells to pack up that sugar out of your cells, when that's not working, that sugar stays
Mm.
there and it just runs amok, you know. Now there could be, and that's when we get into two different types of diabetes. You have type 1, and these are people who, this is genetic, they don't have the insulin, they don't have that key that's going to unlock their cells and bring in that sugar. Or you can have type 2 diabetes, which can come from what we call insulin resistance, which means your blood sugars are always high, you're always under inflammation, and that insulin is always high, and your cells are just ignoring it. Oh, is that insulin again? We're tired of insulin. We're protecting ourselves from insulin. It's like that annoying friend that you're just so used to them yapping, and you're like numb.
Right,
That's
right,
your
right.
body's cells to insulin. So when we start to reverse, like for example, a good thing is like fasting, right? When you start to fast, your body, you don't have that blood sugar increase. So that's one. The blood sugar is not in the vessels. So you're fasting. And then when you fast for long enough, that insulin can actually go down to normal. So now you don't have the blood sugar, you don't have the insulin. Now, if the problem was your cells that were tired of insulin constantly being in their face, now they can start to repair and relax. And so now maybe when insulin comes around, they're a little bit more receptive. And that's just basic, like, science.
So is that an intermittent fast, or is that, because fasting is all the rage now, right? You hear it everywhere. Intermittent fasting. I mean, I have friends who do 2 and 3 day fasts, like, I mean, literally water, and especially my male friends who say that it's the best they've ever felt in their life, right?
Uh-huh.
Um, so is this any, tell me what type of fasting you're referring to, like, or any kind of fasting.
Now, I'm a proponent for any kind of fasting you can do, but not everyone can fast, and you got to be careful with fasting when you're diabetic for different reasons I'm going to get into. But one fasting that I think everybody should do is fasting between meals. And you will realize that that is the hardest type of fasting, meaning that we say it all the time, I eat 3 times a day, but do we really? Because sometimes we'll eat breakfast, then before you know, we eating a little cookie, then we're eating a little of this, then we're eating like that. And you don't notice it, but we're eating all day. So I tell a lot of my clients, if you can just fast between those 3 meals, wow, you'll realize that's a beautiful place to start.
And I know
And then if you can knock out a meal, even better.
okay.
And that's kind of like intermittent fasting.
So interesting. So I intermittent fasted for
Uh-huh.
years. And I worked out fasted in the morning. I usually didn't eat till 12 or 1. And so I may have had 2 meals, right? Um, and it was the best shape I was in my life,
Mhm.
right? But then menopause hit,
Ah,
and it just like the wall was hit, and it
yeah.
just does not, it doesn't agree with me anymore. Um,
Uh-huh.
so it was very difficult for me to find a balance because I'm not used to
Yeah.
eating in the morning, right? Eating
Yes. Oh,
pre-workout.
yes. Yeah.
It's so counterintuitive to me. But
Hmm.
I set an alarm for myself, etc., to eat in the morning. But I try to keep this window tight, right?
Yeah.
Like it's like 8 and 8, like, or even 8 and 5. Like today I'm bad because I didn't start eating till till 6 o'clock,
Uh-huh.
right? I got home
Mhm.
late, but to me, running the numbers up to 8 o'clock is just too much anyway. I can't go to sleep on that.
Yeah. And in a way, you're intermittent fasting. You've just switched the feeding window to making that late meal earlier. And I wonder if some of that hormonal shifts that are
Yep,
happening with the cortisol and the estrogen, like all of that,
all the
is
things.
playing to where the way you were fasting was no longer working because it was causing more stress on your body.
Well, that's
You know,
so
sometimes,
that was actually my cortisol levels went through the roof,
yeah.
which honestly they stayed through the roof. Like they asked me how do you sleep, and I'm like perfectly fine, 7 8 hours a night,
Uh-huh.
and my cortisol levels were through the roof. Like okay, who knows? Um, but so you think everybody should find a level of fast? And so when you say fasting in between meals, because I know everybody's thinking it, when you say fasting in between meals, what does that mean? Like no snacking is what you're saying.
No snacking.
Yeah, let's do
That
that.
that's the one that I really push for. Like if you can't do all the elaborate stuff, like there's some people who can do 2 3 days. I'm not even asking for that. That's beautiful. But if you can just fast, if you could just give me a fast between meals, wow.
God, people who are on, does anybody intermittent fast? It's a question to you guys who are watching or with us. I'd like to know if anybody intermittent fast. I don't know, or have you done a fast 2 or 3 days, whatever. I'm interested. I think we're interested. And anyway, okay, so you're saying we should quit the snacking. Period. Like you're just saying, don't graze, stop grazing, playing games, eat your meal, stop, eat your meal, stop.
So let me show you, let me give you a let me draw something out and show you what your body does when you're constantly eating. So this is I'm going to show you insulin levels. So this is like throughout the day.
Hmm. Can we see it?
Can you see that?
No.
That it's kind
I
of, it's like, okay, let me get my pen. Because this is really,
think it's important.
I'm going to show you real time how your body does this. So this is through the
Hmm.
day, okay? Now, this is what insulin, every time you eat, your insulin level goes up
Yep.
like that, right?
Hmm.
And then when you stop eating, it should go down.
Hmm.
You see how it goes down the
Yep.
baseline? And it gives your body a little time for things to kind of readjust.
Hmm.
Okay, food is out, everything's done. You know, it's kind of like the workers get a break.
Yep.
Workers all go chill. And then when you eat your next meal, it goes up. And you're done with the meal, it goes down. So it should kind of go like that 3 times a day,
Okay.
right? Now, this is your body when you're snacking. So you wake up and it goes up. And it's coming back down, but then you have a cookie. So it goes up a little bit. Then it starts to go down, and then you have some chips. And
Oh.
then it goes down. Oh, it's time for lunch. It goes back up. Then it starts to go down. It's going down. Oh, let me have another cookie. So you kind of do this whole thing, and you realize your body never really got a chance to go down the baseline. Now imagine continuing that day after day after day after day. Your cells would be tired. It would be no wonder that you would have insulin resistance. In fact, your body will get so used to this that when you did do this, it would think you were in starvation mode. It would be scared of this. You would start panicking. Whenever you would get to a point where you've gone 2 or 3 hours without food, oh, you know, something that you were naturally okay and able to do, now is causing your body like a lot of stress, you know. So a lot of times we know that that fasting period where there's no insulin in your bloodstream, there's no sugar in your bloodstream is a relief. You could already imagine it. But how do we do that? And I'm not even going to ask nobody to fast for no day, 2 days, 3 days. If you can give me this for most days, 80 days, 80%, that's going to make a big difference right there.
So all right. So Shanna says that she eats a late lunch and no dinner. So one thing I believe is that you have to find what works for you. I feel like within the confines of doing the right thing, I think you have to find what works for you. Like some people say, you got to eat 3 4 times a day, 6 times a day, whatever. Well, if that doesn't work for you, it doesn't work for you.
Yeah.
Like it's just ridiculous,
Yeah.
right? But I think that I can kind of, I understand that once a day eating. I
Yeah.
do. I get that, like 1.5 times, like maybe something in the morning, like a, some protein and some carbs to get you started, and then nothing for lunch, and then dinner, and then at least before 7, because who wants to go to bed on food
Yeah.
anyway,
Yeah.
right? Okay, that makes sense to me, Shanna. I like that. And Rashida asks, what type of fasting is recommended for women who are pre-diabetic and in perimenopause?
Mm.
Because here, let me just say this. Here's
Yeah.
what we do know to be true, right? And you're the doctor here, but we know it to be
Yeah.
true that because of the hormonal shift, right, your blood sugar is going to be impacted. Like
Yes.
everything in your body is impacted, right? So a lot of women get thrusted into pre-diabetes, right? Because of this perimenopause or even menopause, right? So, what would you recommend it when you have both, like those two things are happening simultaneously?
Yeah. I'm gonna say this, and I know it's gonna sound almost counterintuitive, but I mean, I would just really just slow down and listen to your body, because perimenopause, menopause, there are just so many shifts. Your body's under so much stress
So
that
much stress.
it's
Good.
not a one fits all approach. I think you're gonna have to like really every day see, like even keeping a journal of what worked, what didn't work. Sometimes when you're like following this whole, I gotta exercise, I gotta do this, I gotta do it. Sometimes it might take, hey, maybe not waking up at the crack of dawn every morning. If it's causing you more inflammation, maybe not doing it. So there are different approaches that you can take. This is where maybe skipping a late meal might work, keeping breakfast may be better, doing, 1 day fast, but just seeing what works for your body, because that perimenopause time is almost like a roller coaster. Everyone is different, and it's going to take real just tuning in and listening to your body and how it responds to different things.
I love that. I think that is like a theme to me, especially in this phase. Tapping into, like, really listening, dialing into yourself,
Yeah.
because there's so many things happening. And I remember when I tapped into functional medicine, the first thing they said was, you are doing way too much, working out 6 days, like you're
Yeah.
intermittent fasting, then you're doing this clean keto, like you're doing all these things, and your body's like,
Stressed out.
whatever.
Yeah.
Like you just are stressing your whole body out. And then we wonder why we're having the up and down with the weight, and the blood sugar is crazy, the the blood pressure is crazy, cholesterol is crazy, the sugar's crazy, all the things, right? So I like the advice you're giving is tune in
Yeah.
to your, right? This week may be one meal, 2 meals, right? And maybe it's a walk versus a full working out.
Yeah.
And I believe, this is me, and
Hmm.
you tell me how you feel about it. I think everybody should be checking their blood sugar.
Yeah.
Listen, I'm pricking all day. Listen, I don't know why I'm so obsessed with it,
It's
but I
good.
I just want to know. My husband has a wearable.
Hmm.
Um, I prefer to check because I think it's more accurate, right?
Hmm.
I want to know because I really want to be below
Yeah.
80 all the time. I
That's
want
really good.
60, right? Now, of course, I'm getting a little cheat because I'm doing the tirzepatide. So, but my blood sugar's never been high anyway, right? And I'm
Yeah.
very cognizant of, like, I can tell when my blood sugar's going. I can feel it. It's hard. It's a horrible feeling to me when I'm getting down. I'm eating too much sugar. I'm having fun with it, and then I'm like, whoa, whoa, whoa. Everything starts getting like whatever, and I'll check it 2 hours later, and what am I? I'm at 110. Like
Yeah.
that for me, I feel that. 120, I feel it.
And that's good. And that's the beauty of always checking, because you have so much data and you're in sync with yourself.
Too much
It's
sometimes.
beautiful, isn't it?
Well, sometimes it's over. Like my husband's like, all right. Like you got the blood sugar, the blood. Like you're like, okay, and what you're counting you're in your My Fitness Pal. You're over here with this. Like he's like, give yourself a break. I'm like, I just like to know, because
Yeah.
I feel like I think the one thing I got from this book is that the knowledge is it. If
Yeah.
you know better, you do better,
Hmm.
right? So, oh, look at this. Wait, 72 Hollywood says, I have constant sugar cravings, but was never diagnosed with diabetes. but I know this is coming from being in menopause. What do you what do you have to say, Dr. Woha?
Yeah, I think definitely menopause can come with some insulin resistance. So I think that might be what you're experiencing. And you have to remember that insulin resistance is the gateway to diabetes. So it, while you don't have diabetes, now is the time to really just dial in and like really address, kind of pick line by line through your lifestyle and see what you can change and where you can relax, where you can let go. Because one thing we didn't also talk about is a lot of times when we talk about our health, we're talking about what we can do. But what can we not do? Where
Oh,
can we remove some of that stress? Because stress is a big part of it, right? Like we were talking about the cortisol. If you're stressed out from your job and juggling all of this stuff and your cortisol is through the roof, that's also going to lead to some insulin resistance as well.
so the managing of stress is also a key component, right?
Hmm.
It
Yeah.
in this process of managing your blood sugar
Yeah.
and staying away and staying as far away from diabetes as possible
Yes.
because it creeps up on you.
Yeah.
It's like this thing. And I will say, y'all, waiting for a doctor to tell you, to diagnose you, like, we got to do better than that.
Don't do
Like,
it.
don't wait. Like it's just not, it's because again, Dr. Woha subscribes to something very different,
Hmm.
right? So we're not meeting Dr. Woha's at every doctor's office, and we know this,
Oh,
right? Like,
no.
not even close.
Hmm.
So I would suggest that if you know, because we as women are so intuitive. I'm sorry. Like, we know when something isn't right. So when I hear sis on here talking about, I have constant sugar cravings, and I'm eating I'm eating candy versus food. uh, You don't need a doctor to tell you what may or may not be happening in that situation.
Yeah.
I mean, of course you do, but you don't. Like, something needs
And I'll
to
tell you what's happening with those sugar cravings.
Uh-oh.
This is the,
You go to
I'm gonna go right back to this. This is where you're at. That's where you at. That's Your body is scared to get down here. It's so used to all of this. So you got this roller coaster going and you're just keeping it up. And those sugar cravings, if you can do this, give yourself some fasting, it's going to be hard because your body is so smart. It will get used to what you give it. If you're constantly giving it sugar, then it'll say, "Hey guys, this is the norm. Everybody out, all the workers out. We're gonna deal with this sugar." And the second it stops seeing that, all of a sudden it sends you alarms to your brain that, hey, something's wrong, and you see that as a craving. But you have to fight through that and almost like a withdrawal. Like,
No, is
uh,
it almost? It actually is.
yeah,
It's, I mean, it's 101 withdrawal. I know, like, I am, um, Thanksgiving is coming, right?
yeah,
So everybody would like, okay. And I literally have to set boundaries, like guardrails, right? Okay. I don't need to have five things on this plate.
yeah,
Like, there's no reason unless there are five different proteins
yes,
or vegetables or whatever. And I think that it is addiction. It's pure addiction. If you can't stop,
yeah,
I mean, we just have to be honest with ourselves, right?
hmm,
Like, right. Like, I tell people that I feel that also putting the weight on the doctor when there are
hmm,
things low hanging fruit that we can do right at home, right? From a lifestyle perspective. So
yeah,
you said one, stress reduction. Two, you said that stay up out of that sugar because you said that it keeps you on the roller coaster,
yeah,
right? Or the fasting, finding a level of fasting that works for you.
exactly.
With the snacking, that's low hanging fruit.
That's
That's not
low.
been like, that's not complicated. It's not like somebody's asking you to, okay, stop eating this. But what's the next phase? So let's say you know you're pre-diabetic, right? And you're going to try to manage it at home, like you said, reverse it naturally, right? What are you doing? Because this book is chock full of, like, how you reverse family, like, reverse them. What are the little lifestyle changes that they made?
Yeah, so let me tell you another beautiful scientific thing that
Uh-oh.
we take for granted. It's like if you knew why and how it worked, man, you'd be doing it so much. So the muscles, the beautiful thing about the muscles and how it goes is that Your muscles need sugar to work. When you're exercising, it needs that energy quick. And it's something about when the muscles become active, they don't have time for insulin. We need to suck that sugar up immediately. And you'll notice that some people, when they're taking these diabetic medications and they, maybe they don't eat or they exercise, their sugars will drop to the point where they're like, I can't be moving around too much. I want that's the thing. Being active will drop your blood sugars. Moving your muscles, going to the gym, exercising, weightlifting, resistance training. So get active.
Walking,
Like it for
walking,
anything for your blood sugars.
walking.
Walking.
Okay.
Go out there and take a walk. So it's like if you're not gonna do, just go after dinner and go on a walk. Like let's say you had a meal that you or make it a Thanksgiving tradition. Okay, we all sat out here and ate all this food, and the whole family we're gonna go and walk, and that may mitigate some of those blood pressures. Just little changes like that. Like hey, I take a walk every day, or I take a walk after every meal. Whoa,
Okay.
and that's a big change my father made and saw a drastic change. It was to the point like that one was almost immediate. Like he would notice that his blood sugars would be going down because he was initially still on his
Of course.
medication. And when he was implementing the fasting and the walking, it was like, whoa now, whoa now, what I got to do. And I'm like, okay, daddy, we're going to keep it up. We're going to adjust. But that's what I'm talking about.
So, okay. So you said, okay. Okay. So, Kia asked, how long should the walk be?
Now, I would say as much as you can handle. I like to say this: do what you can do while it's enjoyable, what you can sustain. So I won't tell you that you got to go out there and walk 10 miles on your first, or even a mile. Even if you walk down the street and back to the mailbox and back, if you can do that every day, that's beautiful because eventually that might become such a habit that you're walking around your block every day. But let's start off to where it's sustainable and it's something that you can do regularly. Even if you tell yourself, my walk is going to be upstairs and back. I'm going to walk up the stairs and down the stairs 3 times. That's better than nothing. So I would say the walk should be as long as you can sustain it long term is a good start.
And it's interesting that you say that because when I was training this morning, my trainer said to me, she said, I said, we can add weight. She said, can you sustain it? Can you like, she's like, all right. I mean, I know you can, but can you do it in the 15, do the 15 reps and 4 sets? Can you do that? Like without like being labored and stopping,
Yeah.
like in between the set? And
Yeah.
if you can't, then there's no reason to go up in
And
weight.
she's not trying to be, cut you down or anything, but it's
No.
like, I want you to grow, and you can't grow until you can sustain it. And you will get there, but
Right.
let's do what you can do first and build.
So, Kia, does that answer your question? Like, I mean, you have to start where you can start, right? And if that means being consistent, if you're going to do this after every meal and you know you can do it, then that's what you set out to do. That's what you do, right? If it's 2 days a week, then that's what it is, right? But I always say also, remember, what you put in is
Yeah.
what you get out.
Yeah.
So if you're looking for something greater, then you have to do something
Yeah.
greater, right? But I think as it relates to, when you're dealing with diseases like type 2 diabetes, even pre-diabetes, I think you have to be very methodical and strategic
Yeah.
because you don't, because it's the minute you stop, it's going to come back,
Yeah. And that's why we say reverse.
right? Because there's no, I mean, but cure is not a requisite,
Yeah.
right? Like, I mean, you just want to put it to rest.
Yeah. You can literally reverse it and not have problems with it for years. And I'll tell you about my father. So my dad, we got him from a hemoglobin A1C of 13 to 6.2 to 5.7. His
Hmm.
doctor was like,
Five
what
point
are you?
legit. 5.7 is like legit. Like you're
Like,
doing great.
great. And he maintained that for years. And then, he was like,
I'm
I'm gonna
good.
just go back to, and before you know it, sugar started jumping, and he was boom back in the doctor's office. They were talking about medications, and I remember he called me. He was like, "Oh my gosh!" Like I think he was at an 8 point something, which again is better than 13. So we're talking about an average blood sugar of like 160, 170, better than where he came from, but not where we wanted to be. So now he's back on medications and we're starting all over, you know? And so
Right.
I had to remind him, I said, Daddy, you know, you have to remember what caused your blood sugars to go up, what caused this condition was your lifestyle. And when you go back to that lifestyle, it's going to be right back.
And that's the scary part of the whole thing, like, to me. And it's my biggest fear. Like, I'm like, the reason why the weight is so important to me is solely because as we get older, the mobility shifts,
Yeah.
right? So if you're carrying too much, right, to me that automatically means if I can't move, that means that high blood pressure, diabetes, all these things start happening. So if I
Mhm.
injure myself, there's a problem. Like,
Yeah.
that's what I always, that's where I'm always thinking. And I think diabetes scares me the most.
Yeah.
It, to
It's
me,
scary.
because the comorbidities with that thing is, I mean, just like, and can you explain that? Like, what, so you talk about your dad was in the hospital with pneumonia and all the things. Tell people like the like what happens, what does diabetes trigger in the body?
And diabetes is like, have you ever played, what do you call it, pinball? And then you're clicking that little thing and the ball is
Oh yeah,
hitting stuff. Ding, 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 ding.
yeah, 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 yeah.
That's what blood sugar in your system, when it hits stuff, it's like just destroying whatever. It goes to your brain, it's destroying, it goes to your heart, it's destroying, it goes to your kidneys, it's destroying. Kidney disease, kidney failure, patients are on dialysis. It goes to your vessels, it attacks your vessels. You can't get good blood flow to your legs. Now you're getting wounds in your legs. You can't feel, you don't have sensation in your legs because it's attacked your nerves. And now you have wounds in your legs that are, I don't know how many of us examine our feet every night, but if you're diabetic, you have to examine your feet every single night because you can't feel if you stepped on a pin and that wound is festering. You can't even feel that. I have patients that come in and they have wounds the size of a golf ball in the bottom of their legs, and they're like, I don't know when that happened. And I'm having to ask them, well, are your shoes too tight? I mean, what happened? Maybe the shoes are too tight. Now we have to cut off legs, amputations. We soul food, Big Mama, amputation of her leg, heart disease, strokes,
Hmm.
um,
And this is all a result of diabetes,
just the
the
sugar,
sugar.
just being in your body, the sugar.
Okay, so you keep on using the word sugar.
Yeah, sugar is toxic
All right.
when it's just running amok.
So let's have the conversation because I know everybody's thinking it. So when we say sugar, right? There's sugar in bananas, there's sugar in kiwi, there's sugar in strawberries, blueberries, blackberries, whatever. And then there's the high fructose corn syrup fake stuff,
Yeah.
right? And then there's white sugar that's been over processed to death, but it still comes from sugar cane, right? It's been
Mhm.
over processed. There's all monk fruit, there's this and that. So can the body discern?
Yeah, the body can discern. There's certain types of sugars that your body does better with. And I mean, we already know. I mean, the stuff that's natural, your body knows what to do with it. The stuff that is unnatural, like the high fructose corn syrup, the stuff that's been modified in a lab, and you know, your breads, your the ketchup, even your ketchup, your cereals, all these things that they're putting all kinds of ingredients in, you're eating it, and your body doesn't even know how to, you know, it's taken a lot more for your body to break that down in your bloodstream and utilize it. Speak less of when you're eating around the clock.
So we're all good with the fruit. We're all set, right? But we're not snacking, right? You're saying don't snack, right?
Yeah.
So, okay. So, parents, you're a mom, right? The kids love a snack when they come home from school and all the things. They want a snack in between, right? So, what is that? Like,
So do you remember back in the day where we couldn't have snacks when we came
we
home from
could
school?
not have snacks.
When did
I,
that change?
I don't
You
know.
couldn't have no snack because you were gonna mess up your stomach for what?
For what? Because you got to have dinner. You're going to spoil your dinner. That was it. You're going to spoil the dinner.
That, you know, the old folks were wise.
I, I asked my mother, I said, why you guys had everything? Like you had everything. And she told me, she said that it seemed to be modern to go to the doctor, right? You almost wanted to go to the doctor, right? Because they had quick and easy things, because the herbs and things didn't work like immediately.
Yeah.
Just because you put the onions in your socks didn't mean you were going to be well
Yeah.
tomorrow, right? Just be things like that, right? So, but I said, y'all weren't sick all the time. And now y'all all have diabetes. You all have high blood pressure. Well, my mom doesn't, but all have cholesterol issues, right? And the only reason why she doesn't have those issues is because I am literally like hovering
Yeah.
constantly, because I don't want it to be hard for her.
Yeah.
It's already hard enough for her because she has COPD. I don't want it to be difficult for her to add more comorbidities on top of it,
Yeah.
right? So I'm like, Mom, we're not like, because she likes sweets, and I'm like, you got it. That's for the weekend.
Mm-hmm.
So during the week, we're not. It's beet juice, baby. It's beet juice and green juice during the week. Like,
Oh, and she's so lucky to have you. That's so beautiful.
well, because who wants to be at 75 wants to be struggling,
Yeah.
right? I mean, it's one thing, to be younger and struggling and trying to figure it out, but not at 75. That's not the time for that.
Yeah.
Wouldn't you agree? Like, it's
I
not fair.
agree.
And then to have people on 10 medications, that's not
Mm-hmm.
fair to them. That they have to manage and all
I,
the things. It's not
yeah.
fair. So I
And I'm
feel
like, in the hospital all the time. That's the first thing I do is I say, what medications are you on? We lay them out on the table. I look at and sometimes I'm like, golly, there's just so much. I mean, and that's where I look at some of my patients and clients is let's try not to get you there because we got time to reverse you so that you're not 70 years old on 13 different medications that you're
that you're dependent on.
dependent on.
I, okay. So, and that's what's all scary to me. It really is. It's unsettling. And I
Yeah,
don't think any of us deserve it. And this message is for everybody. But I think that as Black people, I think we have to focus on, because we like it smothered, covered, and all the things, right? I just think we have to be cognizant of what's really happening,
we
and
gotta.
what the intention is to have all these things available,
Yeah,
right?
yeah,
Because these are making, and we're not going to even go down the road, but I'm just saying, we are customers. And what do you want? You want your customers to spend money. And trust me, if we all got well, who's going to be in the hospital?
we can't be the main ones in the hospital.
We can't be, because for a myriad of reasons. I mean, for a myriad of reasons. And so I think that it's just important that we focus on the things we can control, right? Like, even in the book, you mentioned sleep,
Yeah,
right? How important is sleep to this process, to this managing and reversing type 2 diabetes?
man, sleep is the cornerstone of everything. I always tell my clients and people, if you knew how much money and time and the powers that be are investing to crack the riddle of sleep, you'd be sleeping so much. Sleep is so important. They're trying to figure out why. And then you got people who don't want to sleep. They say, I'll sleep when I'm dead. That don't even make
It's
sense.
so dumb,
Sleep
because you're
is
not sleeping.
so
You're dead.
important. Sleep is so
You're not sleeping.
good. Like a
It
lot
is
of
so.
disease processes come from a lack of sleep. They stem from a lack of sleep. In fact, if you have, I bet you this, a lot of times people will say, oh, I got sick, I got a cold because I went outside and the weather was bad. And I'm like, no, try to get to the bottom of it. The weather was probably bad, but track it back to your bad sleep the night that you didn't sleep. Let's say you had a project due or you had something due, and I guarantee you it was after some time where you didn't sleep and your immune system went down. It wasn't just the
And I
weather.
love that you said your immune system went down,
Mm-hmm.
right? Like, literally, our body is a machine. It
Yeah,
can go down.
it can go down, systems down.
And it's what, like, so for instance, I got, I told you I get these UBI infusions, where they take the blood out, they expose it to ozone and UV light, and then put it back in.
Uh-huh.
And I do that to get rid of impurities in my blood,
Mm.
right? Because again, I don't think my immune system is the strongest.
Hmm.
So with that, I'm just trying to mitigate, right? And so far, so good. This has been a great season for me, which, it wasn't so great last year.
Yeah.
So, but I think that sleep to me, like seriously, after we get off of this, I'm counting backwards. Like I'm like, all right, like it's time to bring this whole thing down. I am out, lights
Yeah.
out, 10 o'clock at the latest.
Beautiful.
Like I need it. I can't. I don't know about you guys, but that are on. Do you sleep? I don't know. Are you getting, like, how much sleep are you actually getting? Is what I should ask. Um, because if you're not, you need to figure out what. Now, so speaking of that, if people aren't getting sleep, because you're saying it directly, the lack of sleep directly impacts diabetes. Like
Yeah.
it's definitely part of the
Yeah.
puzzle that can get you.
Hmm.
So when people say that, oh, 4 hours,
Oh, oh my.
I
That is,
this, I'm not shaming you. I'm not. I just I'm shocked. Shannon, shush. Shannon says she's in bed right now. Lights out when we're done here. Um, I'm not trying to shame you when you're saying that it's 4 hours. Like my shock, it's just shocking to me how you have the energy to do the things you need to do during the day, right? Like for, I don't know, Dr. Woha. I'm so shocked at 4 hours.
yeah. Um, and 4 hours, like I've heard that. I've heard down to 2 to 3 hours. Some people saying that. And I say this, like, and some people say, oh, well, they say that 8 to 10 hours. And listen, they've done a lot of studies. They've done a lot of studies that they find that 8 hours really is the sweet spot for humans. We do, for whatever reason, need to lay down, close our eyes, and turn it off. And our body needs to regenerate. So a lot of times, we're dealing with insomnia. Somebody said something about insomnia.
Mhm.
There are different medical problems that can affect your sleep, from sleep apnea, if you're having breathing problems, back problems. But I would suggest just getting to the, like, fixating on making it a priority to get to the bottom of that, so you can create a safe sleep environment so you can rejuvenate. Like, just as much as you plug in your cell phone and charge it at night so you can use it the next day, that needs to be the way you treat your body. And if your charger wasn't working, or if your phone plug wasn't working, you would get to the bottom of that, because you got to use your phone. So you got to get to the bottom of your sleep, because you got to use your body, not just for the next day, but for the next year, and the year after year after year. You want to plug yourself in to regenerate so your body can be useful to you in the years to come.
I I just think that's such a powerful message, y'all. Like I understand we have to work, right? We've got to provide. I really get all that. And I mean this from my, like, deep down. But if we're not fueling our body properly, if we're not managing stress, if we're not sleeping, if we're not moving, right? If we're not having intentional movement, you can guarantee that it's a recipe for disaster, right? And Holly, like I'm sorry, Holly. I didn't know that was you. You did tell me that you were sleeping 4 hours, and I'm just as shocked now as I was when you told me. Right? Like it's just not enough. And I feel like you said, trying to figure out what it is. And Holly's a rock star in the gym. Like she's a monster in the gym. Like she gets it in. So for me, I don't understand how you're not laid out. Like I sleep well, I think, because I work out hard. Right? Like my body is tired. So I don't see how I can keep on going. So I are there any suggestions you can give to people that aren't sleeping?
Yeah. So one, I would say, get to the bottom of any, like, possible medical problem. Make sure it's not sleep apnea or pain or anything that obviously you want to make sure that that's solved. But then two, always say, if you could train a baby to sleep, you could train an adult.
The little
So have your
no,
sleep.
but okay.
Yeah, you have your sleep regimen. Your body can be trained in so many ways. And you just literally treat your body like a child. and you give it certain areas. Like one thing I say is, okay, some people, when they get in bed, their bed is no longer a trigger for sleep. You know, people who sleep well and have like this sleep regimen, one thing they'll tell you is that once I get in bed, I'm out. I can't even go near the bed. Some people tell you I can't even go in a room with a bed in it because I'm gonna start being sleepy. But that's because they've kind of train their minds to associate the bed with sleep. Now, if you're noticing that you're having a hard time sleeping in bed, then that means you got to cut out the reading in bed, cut out the scrolling in bed, cut out the watching TV in bed. You have to maximize that bed for just sleep, meaning that it should be to the point where when you're like, let's say you're doing like an intensive sleep regimen, like an intensive sleep boot camp. When you get in bed, if you lay down for 15 minutes, I used to tell patients this, you lay down for 15, 30 minutes. If you're not sleeping, get up and go to the living room. When you start feeling tired, go back to bed. Give yourself another 15, 30 minutes. If you're not sleeping, get up. I guarantee you do that for like 3 or 4 nights. After a while, your body will be like, actually, I give up. Bed is for sleep. Because what you're actually telling your body is, I'm not going to tolerate you doing anything else but sleeping in this bed. I'm not going to do anything else. Your mind is whining. It's telling me, give me a book, give me something to scroll, give me something to read. And you're telling your body, no, this bed is for sleep. And
And
those are just some methods you can use.
I have found temperature, like we sleep at 67, 66 degrees, right?
Yeah.
I have found, and with the fan going, like the ceiling fan going, I have found that for both my husband and I, it is a recipe, and also the progesterone.
Yeah.
I'm like you're,
Progesterone, yes, will work.
and
Yes.
and, and mag glycinate.
Uh-huh.
So my sleep regimen in the evening is mag glycinate, vitamin D, of course the progesterone, the 67 to 66 degrees with the fan on, and it is like I can count. If I get in the bed, I can count backwards
That's a recipe
from
for
10.
success.
It is a recipe for success. Again, out of 365 days, maybe 10% there's some issues, right? Where
Mhm.
I'm late, I come home late, which slows down my process, right? I'm too excited or anxious about something. But I feel like everybody, you need to find your sweet spot. But factually and scientifically, sleeping in a warm house, in a warm room,
It's
that's not a good.
hard. It's hard.
Yeah, yeah. So turning your heat on because you're cold, put some socks on and get in the bed and turn that, make it cool.
Yeah.
Open the window, something. Right? Am I right, Dr. Woha?
Yeah.
Like,
Yeah. And then check your iron levels, check your vitamin D levels. And if they're low, take some vitamin D. Sometimes insomnia can be caused by low iron levels. Now, mind you, if you're a Black woman and you have fibroids and you're having heavy menstruation and you're anemic, iron deficient, and you're having insomnia, that's it. That's it. I can't push it. Like it, once you get that under control, that's where I talk about different medical problems that can cause um, sleepless nights. You know, if you're hypothyroid, if your thyroid levels are
oh,
not good,
oh,
and you run your thyroid into the ground, your adrenals into the ground, and you're constantly dragging through the day, you haven't even. I don't know. Like when you get into the bed because you've been laying down all day, now the bed and sleep ain't connected at night like it should because you're fatigued, but you're not tired enough for a good night's sleep, if that even makes sense.
it makes 100% sense because tired and fatigue,
Different
like sleep, all
things.
different things all together,
Yeah.
right?
So sometimes your insomnia or your lack of sleep could be, I need to maybe go get some labs and we speak to some healthcare providers and just make sure that everything. And now, just because your labs look good, you got to find some good providers that are going to go in tooth and nail with you and figure out what's going on. Because sometimes labs that are in the normal range, when you're having a problem, still need to be investigated, worked on. I know you were talking about you work with functional medicine, and they're really good about that.
I
So,
want to get, okay, I can't let you, I cannot let you go without this. So I think it's important to really advocate for yourself in a
mhm,
healthcare environment. Even with functional, you still have to advocate for
yeah,
yourself. And the testing game is a funny game.
It is.
right? So I love when people say, I got my full metabolic panel. So you got your A1C and you got your, your ferritin. Okay. You did your vitamin D and all the things and your Bs and all that. Okay. But you can take it a step further. And I believe that you should go with the list and you tell the doctor what tests you want them to
Yeah.
order. Okay. So
Yeah.
I want you to do the full metabolic panel and fasting. Tell us right now, please. Yes, you want them to do the fasting. What is it? Because A1C is very different
Uh-huh.
than like fasting insulin, right?
Yeah.
So where,
Yeah.
give us
C
all the proper
peptides.
tests that you need to have. What are the proper
Now,
tests?
it really depends on what you're looking for. So different people in different situations may need different things because sometimes too much information, you may not know what to do with it. But if you are having, like, let's say cholesterol issues or you're worried about heart health, they have that LPA that people are wanting to get that they're saying is more specific
Mm-hmm.
than the cholesterol. That's great. If you're worried about your thyroid, not just your TSH and your FT4, sometimes they have like your TPO, your
Yep.
reverse T3, and just not your basic thyroid labs. There are some additional tests that you can run to give you more insight on what your thyroid is lacking. A lot of times physicians will do the TSH and the T4, they won't do the T3. Very important. Sometimes when you're doing, if you're looking for insulin resistance, that A1C is helpful, but sometimes you want to check your insulin levels. You want to see if your insulin's even responding appropriately. You want to see like your C peptide to see if there's any kind of autoimmune issues. But it just really depends on finding a provider that is one, willing to order this stuff, willing to have that conversation, open to having that conversation with you, like what you're looking for, and doing running these tests.
And I appreciate you saying that because so if you attended Elevate Pause, I drilled down on this, right? That we spend a lot of money on a lot of things. And so when I hear people say that is too expensive as it relates to your own health, it literally sends chills up my spine because I'm like, yikes. Like, no. Because if your children were sick, you would mortgage your house to ensure that they got the best of the best. But what about you? Right? So I say all that to say that having good providers, sometimes it's going to cost you.
Yeah,
Right? And you'd be surprised that it's less than probably what you think, right? When you're dealing in a functional integrative environment. But people that understand the right test to run at the phase that you are in your life at that moment. Because what you
exactly.
need as a perimenopausal woman is quite different than what you need as a postmenopausal woman.
Exactly.
So I, I like Dr. Nwoha, can you please tell everybody what you do, like your business that you
Yeah.
have as it relates to your patients? Let's hear about that.
Yeah. So I like to lay everything out. I am the one-stop shop when it comes to your health. Not your medicine, but your health, because it's two totally different things. Um, we talk about what your day looks like, what your food looks like, what labs you want to order, what you want to talk about. If you meet with your doctor and your doctor says something to you that you don't understand, I meet with you and we break it down and we formulate something to go back and talk to him. I have clients where they say, okay, I want to come off of this medication, that medication. We formulate a plan. We work with the doctor. When the doctor gets pushed back, I say, okay, well, let's try it this way. Well, let's try it that way. We kind of collaborate. I am your resource to getting your health back. If there's a lab you don't understand, if you want to know what to do, if you want to know how to pose a certain question to your doctor, if you feel like you're not communicating well or you want a second opinion, not a second medical opinion, but a second health opinion, that's what I do.
And you're being very clear about what you're saying here and intentional,
Hmm.
not a medical opinion.
Right,
What you said, not a medical opinion, but a different
right,
type of opinion,
right.
right? I
Yeah,
think that's important. So when you lock in with somebody like Dr. Wohat, it's different. It's like having a consultant, honestly. It's like
yeah,
having a consultant, right, who's walking you through this process so that you can get the best level of health or reach the optimal wellness
yeah.
that you that you can have for your life.
Like, I'll give you an example.
Mm.
So, I had a patient that was having difficulties with her blood pressure, and we were bringing them down. And what we noticed is that her blood pressures were always great at home, but every time we went into the clinic, they were high. So, it was like, okay, her doctor was saying, well, our machines are right. We're doing everything right. It was to the point where I told her, okay, well, take your blood pressure machine to the clinic and let's test it against the clinic's machines. It wasn't a machine problem. With enough, I was able to pose questions to her that she probably would have given up on or let go. I was able to help her frame her questioning to her doctor to where she was able to get into a cardiologist because her doctor wasn't really comfortable coming off on it. Because the disparity, the differences in the blood pressures were very high. I think she was in the 170s every time she was in the office. She was able to get an appointment with the cardiologist. She was able to then pose those questions with the cardiologist, and the cardiologist agreed. The cardiologist agreed, and now she's off her medications. And she went one step further to the cardiologist diagnosing that it was anxiety that was causing it. And he ran an additional test, did a stress test, found out her heart was perfectly normal during the stress test, blood pressures were perfectly fine. But it's like she she was on three medications
Oh my
when
God.
she first started with me, low starting like strong medications. And just because we were able to go back and forth and try different things, okay, let's check it at home, let's check the monitor at home, and let's frame these conversations to your PCP in a way that they can receive them. We were able to get that answer. And so she's thrilled. She's off her medications, and she feels comfortable in her heart because she has the backing of a PCP, a cardiologist, and to her, she feels like she shut that chapter, closed that chapter, and that would have never been done if she didn't have the assistance of someone who knew the ins and outs of the
A
system.
wellness consultant. Like, I mean,
Yeah,
seriously, like that's really what you're providing. You're being a conduit, right?
yeah,
Because sometimes, doctors have tunnel vision, especially in conventional, right?
yeah.
It's how many minutes do you get? 11,
They
13?
they don't have time to. They really, and I love my physician colleagues, but I'm going to be honest, they don't have time to. It's easier for them to increase the medication and move on.
Right. And that's when nobody's attacking anybody. We're just talking about
No,
what the facts are,
the
right? Like,
facts.
Holly asked, how can they get in touch with you? Dr. Wool, how you want to let people know how to get in touch with you?
Yeah, so my website is adawellmed.com. Um, I have a link on my profile. If you click my profile, ADA Wellmed, and then it could put you through. You can send me an email, anything ADA Wellmed, basically at gmail.com, and you can make an appointment. Um,
Yeah.
yeah,
Med.com. Also, okay, so you know how we do.
yeah.
We have this. All right. So I guess I'm in the business of giving books away because my doctor friends are incredible. And I want you guys to have access to these things now because it's the holiday season. It's my favorite holiday season. Okay. I love it. And also because my birthday's coming. Yes, I must say that. Um, I know somebody wants this book. Okay. So I am going to have whoever's 5 DMs like right now. The first five, that's who's getting it. Send me a DM. Um, Send me a DM to Stacy V Bryce. And with your name, full name, address, email address. And I'm doing all of my mailing on Monday, this Monday, because I have some Generation M books that need to go out. And we're going to mail out reverse type 2 diabetes naturally. Okay. Unless I want to order these, Dr. Woha, and you want to sign them.
Okay, yeah. I'll send you some more. I'll send them out to you.
We'll work that
Yeah,
out because books matter, honey. So let's not, okay.
yeah.
I'm focused on this. I'm oh, Jessica says, I'll send you some. I'm like, no, don't let me go buy
No.
them. But I just think this is a valuable conversation. Now, you have a third book coming. Am I saying this right?
Yes. That's gonna be my baby. I'm so excited.
And that's that's the cholesterol.
Well, I'm gonna do reverse weight gain. So I want to focus on weight gain. You know, I'm board certified obesity medicine, so that's my passion. So I want to address this because I feel like weight gain, there's a lot of big misconceptions, a lot of big blaring misconceptions that I want to address.
So I'm just going to take a few minutes on this because I think it's important while we're here, because one leads to the other. I am blessed because I just am not, I'm not pre-diabetic, right? I think I'm lucky because I'm so hypersensitive to it. But I feel like if I wasn't, it would be something
And
very
you're
different.
active. You're
I
very active.
am very active, right? But
Mhm.
still, it doesn't change the fact that I'm carrying too much weight, right?
Yeah.
Um, and I think that, and I said this at Elevate Pause too. First, it's time for us to get people who are qualified in our spaces,
Hmm.
not people that set up an Instagram page last week or a TikTok page and no diss. I promise you. And you just got certified to be a personal trainer, and you now think because you're so fit that that means it's one way, this way. The
No,
only reason why people gain weight is because they're eating too many calories.
no,
Oh, really? I am a testament to this.
no,
Not true, right?
not true.
Oh, and you have no idea what you're talking about. So I really, 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 really think that, guys, I'm begging us to lock in,
Yeah,
right? And really, like as we're doing our budgets for 2025, like allocate some cash to this arena, what we're talking about here, right? With Dr. Nwoha, like allocate some cash so you can get some people in your space that know what they're talking about and can give you information that will move the needle for you.
yeah,
Okay? Like seriously, I'm begging you because it's changed my life and how I view everything that's happening to me. Because typically I'd be posting pictures of what I used to look like, which I'm gonna do so you can get context on why I'm so laser focused on it, right? But it's not all about the look either. It's about your wellness,
hmm,
right? Like I even got my inflammation markers checked, right?
wow,
I got my inflammation markers and my body, and I got specific body fat markers based on how much water I have in my body, right? How hydrated I am. And it made a difference on how I looked at it. But what I know is that if you have more body fat than you have muscle, you've got
yeah,
inflammation. This is what you know.
yeah,
It's a fact. So that does not necessarily translate to pounds on the scale.
yeah,
Right? I happen to have at this juncture more muscle than I have fat. It's the margins are slim, but I still have more muscle than I have fat. Right?
and that's a beautiful thing.
It's
Yeah, because that
unbelievable.
muscle is active.
Correct. And I have to keep on moving the needle. So getting our head out of the space of the pounds on the scale versus what is the body, as you said, what the body is doing. So that's why I want you to lock in with people like Dr. Nwoha because she's going to bring us there.
Yeah,
We can follow her on TikTok. You can hire her,
yeah,
right? You can follow her on Instagram. We need to lock in. That's, I'm just trying to impress upon you that we can make the changes ourselves, but it's not as simple as I need to lose 30 pounds.
yeah. It's
Am I right?
not. It's about just getting healthy. Like it's about taking care of yourself. It's about loving yourself. Because when you love yourself and you love everything about yourself, you're gonna take care of yourself. I want to say in the hospital, a lot of times I'll have patients that will say, I just want to go home. I have dogs to feed. I got to go take care of my cats. And I'm like, you just had a heart attack, you're dying, and you want to go take care of your dogs or your cats. And oftentimes I realize that a lot of people take better care of their cats, their animals, their family members, their children, their homes, their cars than they do of themselves. And a lot of times that reflects on what you think of yourself. If you're taking better care of the things around you, of your pets, of your, family members, of your children than you are of yourself, that's a red flag. So in 2025, we have to start shifting some of the focus inward. You know, we're
Love
not
that.
buying our dogs, that premier dog food and we eating at McDonald's. We're not pumping, premium gas in our Mercedes, but then we eating takeout from whatever restaurant, we need to shift that focus in ourselves and make sure that every asset of our lives we are pouring into, so that we are a reflection of how much we love ourselves. It shines on our bodies whenever we go out.
That was a word. I mean, that, like, honestly, that's the net of all of this,
Yeah.
right? And also that we have
Yeah.
longevity, right? As Dr. Sheila says, can you get on and off the toilet? That's gonna
It's gonna
be
be a struggle one day, you know.
right. And can you do it? Are you independent? Do you
Yeah.
need somebody to line up your meds for you? Like, who wants that?
We're not supposed to age like that. That's not normal aging. But the society is normalizing it, but that's not how we're meant to age. We're not supposed to be demented in our old age.
I had to teach my mom that, like, because she thought that you're supposed to hurt. You're supposed to have arthritis. And I'm like, "Mommy, get that castor oil, okay?" And she's like, "Oh my goodness." I'm like, "Y'all used to use castor all the time." She's like, "But not for the reason, not the way you're
Yeah.
using it." Right? Rubbing it on your body because her hands are arthritic. But now she puts it on there. She can still craft all day and all the things. It's not normal. I was like, "It's not normal, Mommy, like, at all."
Yeah.
It's not. We should be out here doing what we want to do at 80 years old. Like, we,
And I think there's going to be a shift because I feel like the baby boomers were misled because they trusted the medical, they trusted medicine so much. Like you were saying earlier, they did trust the doctors that came in front of them, and they were misled in some ways. They thought that the medicine was going to be the silver bullet to solve everything. And I feel like the generations after them are realizing, like, I don't know about this. They're backpedaling. And I think we are going to see a change, and that needs to happen, because medicine, while it is good, I'm a medical doctor. I love medicine and what it can do for certain sicknesses and illnesses. It turns things around, but we can't be dependent on it.
and I think that's it. And I think, like, and we won't even get into politics, but like the wheels are off the bus, right? Like, I get that we don't need fluoride in the water. I get that we shouldn't be doing some of the things we're doing, but we can't go from one extreme to the other.
Yeah.
Right? Society, number one, is not ready for it. We don't need chemicals in the food. We know this. It doesn't take a rocket scientist to figure that
Yeah.
out. Right? But we can figure it out for ourselves.
Yeah.
Like, you know what I mean? Like, I found a cookie. I think I told you this before. I found a cookie that has 3 ingredients in it: flour, sugar, butter.
Yeah.
That's it. Right? Why does it need to have 10 or 15, like, high
Oh my
fructose corn syrup?
gosh.
Right?
And now they're having these genetic modified ingredients in them, and it's
And
getting
all the fake
crazy.
meat and all the things. But all right, so we're gonna get, okay, wait. So I don't know if you guys were on with Dr. Nwoha when we had this, when we did the reverse high blood pressure, right? All right, I'm really feeling generous. So who wants this? Right? So I only have 5. That's it. Ian, with all the information, I will get you that book. All books are going out on Monday, so don't stress me out about it. Okay. Dr. Nwoha, I adore you.
I adore you as well.
I
Thank you for having me again.
absolutely adore you. Now, here, you have to promise me in 2025, you're going to be in the A.
I'm coming. I already warned my husband. I was like, I'm mad I missed the I'm mad I missed the pause event.
No, you can't. You won't. No. And what's coming next is like what's right up your alley. So I want you guys to go follow Dr. Nwoha, TikTok, Instagram, get into that. We're going to get these books out. If you buy, that's that. Rocket science. Let's go to Amazon and buy it. Right? What else do we need to? And if you want to get with Dr. Nwoha, I pinned her website, so get over there. Shush, Dre. My friend Andrea said, Stacey Oprah Washington. Quit it, Andrea. You get a book. You get a book. You get a book. www.adawellmed.com. Let's get on that. And let's support Dr. Nwoha on the things that she's doing, because she's out here trying to help us. Yes?
Thank you.
Okay, Dr. Nwoha, I love you dearly, and we will chat so we can chat. Yes?
All right. All right.
Guys, thank
Thank you
you
for
so
having
much.
me.
All right, we'll talk
All
soon.
right.